Hi, everybody. My name is Yoni Seiden, he, him pronouns. I've been saying I'm an M4, but I realize that's confusing because M4 is just like matched into residency. I am out on a dual degree right now at the Ford School of Policy. And so my cohort is our M4s, but when I come back, I'll be sort of joining the M4 class. I come to medical school by way of social work. I used to be a social worker. I worked primarily with teens and kids, did some community organizing work, decided to go back to medical school and kind of came in with like a vague interest in policy and like issues of sort of social justice and things like that, but didn't necessarily know what that meant. And since coming here, I've been involved in a few different types of projects, including and started to really get involved around maternal health issues. And so now most of my work is around maternal health disparities, maternal mortality, things like that. Some of the things I've been involved in here, I should note, I'm applying into OBGYN next year. In case my interest did not make that clear. Some of the things I've been involved in here are helping with the transition from in-person to hybrid virtual care during COVID. From that, we started a support group for pregnant people at Michigan Medicine to help sort of with the new stresses that come up. That also kind of led to thinking about ways to organize social needs for patients. So working on a project right now to better organize how we work on social needs. And also thinking a lot about sort of implicit bias and how that manifests itself in clinic. I spent last Wednesday, though, virtually in our state capital of Lansing, advocating for postpartum Medicaid extension, which actually looks like it might happen in the state if there's lots of support for it. So kind of involved in a lot of like random places. I have a kind of non-traditional route to health policy and health policy research, but happy to answer questions and bring in the experiences of my classmates as well to help sort of explain things.
What a perfect transition. Yoni, can you tell us a little bit about how you initially got involved with health policy? And it sounds like this might actually start from before you started at Michigan, but I invite you to bring in any of your experiences here to let us know about how you got started on this journey.
I would say it did not start before Michigan in the sense that like I was definitely interested in like how do we make people healthier on like a macro level, but didn't really know what that means. I remember I had a conversation like in the spring before coming to Michigan with my boss at the time. And I was like, is there a thing called health policy that people do? He was like, yes, this is an entire field. But my path was really, it started with the path of excellence, which Dr. Gould leads that we have here. I joined the path of excellence in health policy and really kind of got a primer in some of the big themes. They ran sessions in like, what is Medicare? Or like, how do we conceptualize, like, what is the role of health insurance companies in social disparities? How do we conceptualize like, researching health? Like who needs to be at the table? Kind of like the big buckets is what they helped us think about. They also help connect us to research mentors and things. So I had a couple of false starts, admittedly. I had a couple of research projects that I kind of started and didn't really work out and weren't quite the right fit. But I just kind of like hung around, especially in one year. I went to events at the Institute for Healthcare Policy and Innovation, which is like an incredible resource that we have here at Michigan. Over 1,000 faculty members from across the university are involved in it. And over time, sort of fell into projects just by having conversations with physicians that I was meeting that I thought were doing interesting work.
I'd love to know what stands out about Michigan with respect to DEI related efforts.
Yeah,
and then Sarah, we'll go to you next.
That is a good question. So I have been involved in, as I said, so I've been involved in some maternal mortality work, which is like deeply interconnected with diversity and equity, especially because I'm sort of thinking a lot about implicit bias, and how do we kind of negotiate between what happens in clinic and the structural barriers to health, right? Like you can't, both are necessary, but neither are sufficient, is what the data tells us. That was a little bit hard for me to come to terms with as a community organizer. I wanted to only do structural things, so I'm kind of going backwards. Michigan, I think, has been pretty honest and open about its need to work more on these issues. Like many large healthcare institutions, it's not alone. It has unique challenges, though. So not only do we have a really strong student diversity task force, not only do we have many researchers who are thinking about health equity and access to health equity at IHPI, I am also involved in a lot of projects that are trying to bring like sort of a DEI approach to everything. So I'm on a curricular grading committee, and we're like asking questions about racial equity in our clinical grading, right? You don't only need to talk about that in the student diversity initiative. So those are kind of some of the big broad buckets. For my work in maternal mortality, one of the ways it's manifested is by saying, okay, one of the things that we need to do is to reduce obstetric hemorrhage. But another thing that we need to do is to make sure that Black women's needs are being attended to, that when they come into our clinics and they say something's not right, that we listen to them. And so we've really been approaching both clinical as well as social indicators of mortality risk.
Yeah, I actually work with a mentor in IHPI right now, and I'm hoping to continue working with them when I start school there. And I'm just wondering, like, logistically, how much time could you work on projects, and like if you got funding through IHPI or what that looks like?
And 1 year, a lot of folks kind of dip their feet in, do things as they feel able to, and sort of flexibly. That first summer, there is a month to work on projects. I did like a huge amount of work that summer. I did 2 projects, like self-initiated. So you're definitely able to do a lot of work then. You go underground for clerkships, but then when you come out into the branches, it's like this beautiful experience. Most of the work I did in the first 2 years, I did not really continue. And in the branches, I like found new mentors. I found new things I was interested in. I asked new questions. There was a pandemic, but I would say what's cool is you get 2 waves of an ability to research and think about big questions. And the thing you do in your first wave doesn't have to be the thing you do in your second. So I think we have a great opportunity to do a lot in those 4 years.
Awesome. Thank you so much.